What stands out about the data for PROVENGE is that it has been consistent each time it has been tested. PROVENGE was the first cellular immunotherapy approved by the FDA and treats asymptomatic or minimally symptomatic mCRPC. And whether it's a randomized trial, claims data study, or registrational trial, patients who received PROVENGE were observed to live longer. The data that stands out to me the most is the real-world data. This is important because these are not carefully selected trial patients. They don't have carefully constructed guardrails often seen in clinical trials, but are everyday patients treated in actual situations. This real-world study of mCRPC treatment indicated that men receiving PROVENGE and an ARPI had a longer life than those patients who received treatment with an ARPI alone. Specifically, men who received treatment with both PROVENGE and an ARPI had a longer overall survival by nearly 15 months, suggesting that leveraging mechanisms of action may benefit patients with mCRPC. This is consistent with how we treat all cancers. We strive to leverage multiple agents and modalities to treat cancer. PROVENGE and an ARPI are no different. I was happy to see this because this is how we treat patients in our clinic. Based on the impact of the first study, we followed up with another study to confirm our results. Again, in this different claims data set, we compared overall survival between patients who received PROVENGE and an ARPI within 6 months of each other, some who received concomitant treatment and some concurrent, and those who received monotherapy with an ARPI. The median overall survival was 30.4 months in men with mCRPC who received PROVENGE and an ARPI, and 14.3 months in men who only received an ARPI monotherapy, a 16.1-month difference. After adjusting for significant prognostic covariance, patients in the PROVENGE plus ARPI cohort had longer overall survival than those in the ARPI monotherapy cohort. These findings indicate that patients being treated with PROVENGE and an ARPI lived longer. I will note that claims analysis like these are limited in their ability to predict treatment effects, and individual results may vary. The claims dataset does not include certain safety or clinical assessments. The analyses were exploratory, and the results need careful interpretation. The current study also looked more carefully at the nature of the first and second line treatments, observing that most patients who receive an ARPI as first-line therapy continue the same ARPI after PROVENGE has been administered. This is how we treat our patients, and patients live longer when they receive PROVENGE plus an ARPI. I believe PROVENGE is working for my patients because the data has been very consistent in the studies that have been performed.
Indication: PROVENGE, sipuleucel-T, is an autologous cellular immunotherapy indicated for the treatment of asymptomatic or minimally symptomatic metastatic castrate-resistant hormone-refractory prostate cancer. Important safety information. Acute infusion reactions. Acute infusion reactions reported within 1 day of infusion may occur and include nausea, vomiting, fatigue, fever, rigor or chills, respiratory events, dyspnea, hypoxia, and bronchospasm, syncope, hypotension, hypertension, and tachycardia. Thromboembolic events. Thromboembolic events, including deep venous thrombosis and pulmonary embolism, can occur following infusion of PROVENGE. The clinical significance and causal relationship are uncertain. Most patients had multiple risk factors for these events. PROVENGE should be used with caution in patients with risk factors for thromboembolic events. Vascular disorders. Cerebrovascular events, hemorrhagic ischemic strokes and transient ischemic attacks, and cardiovascular disorders, myocardial infarctions, have been reported following infusion of PROVENGE. The clinical significance and causal relationship are uncertain. Most patients had multiple risk factors for these events. Handling precautions. PROVENGE is not tested for transmissible infectious diseases. Concomitant chemotherapy or immunosuppressive therapy. Chemotherapy or immunosuppressive agents, such as systemic corticosteroids, given concurrently with the leukapheresis procedure or PROVENGE, has not been studied. Concurrent use of immune-suppressing agents may alter the efficacy and/or safety of PROVENGE. Adverse reactions. The most common adverse reactions reported in clinical trials, greater than or equal to 15% of patients receiving PROVENGE, were chills, fatigue, fever, back pain, nausea, joint ache, and headache. Please see full prescribing information on provenge.com. To report an adverse event, please email our pharmacovigilance department at drugsafety@dendrian.com. or fax adverse event details to 833-464-0123. Please provide details pertaining to the adverse event and provide contact information so that our pharmacovigilance team may contact you with any questions. To report a product complaint, email our quality department at cqacomplaints@dendrian.com. Please provide details pertaining to the quality issue and provide contact information so that our quality team may contact you with any questions.